This method of tracking involves 3 attachments to the tool. The end of the middle attachment, in red, is found by finding the minimum angle between the 3 attachments using their direction vectors. Once the middle can be found, the left and right attachments can be differentiated from one another, and the tip of the tool can be predicted. We're not moving forward with this method since having to account for all 3 attachments simultaneously is not very robust. If the leap motion controller cannot see all 3 attachments, then the tracking fails. One advantage to this method, as well as the next few, is when multiple attachments are used, it is hard for the rod to be mistakenly perceived by the controller as an attachment since angle constraints can be assigned between the rod and the attachments. The next 2 methods find the position and direction of 2 attachments to the tool. This method makes the distinction between left and right using the location of the palm of the hand. Right is shown in red, left in blue. When the palm is in view, this method works fairly well as the palm is large and easy to locate. The obvious downside is that in a real surgical setting, the palm will not always be in view. When the palm or either of the attachments are out of view, this approach fails. This method distinguishes right from left by using the length of the attachments. The attachment on the left is shorter. This method imposes no constraints on where the palm needs to be, but the big downside is that the leap has trouble making accurate predictions about the length of the attachment. This method uses one extension pointed downward from the surgeon. This is similar to the most successful method in that only one extension is needed and the other point of reference used is the end of the handle. The downside to this is that the tracking software often gets confused between the attachment and the other side of the handle.